Is your bladder working the way it should? You might be surprised how many people just put up with urgency, leaking, nighttime trips to the bathroom, or even pain when urinating, assuming it's just normal for them. But here's the truth. Bladder dysfunction is not normal, and in many cases, it's fixable. In today's video, I'm going to walk you through 8 key signs of normal bladder function so you can see exactly where your bladder stands and what might need some attention. This is really important information that every adult should know, whether you're recovering from surgery, dealing with leaks, or just curious about what's normal. So stick around to the end because I've got a free tool to help you assess your bladder health and take the first step toward improvement. So Bradley the bladder and I are going to start with these 8 key things for a healthy bladder. Let's start with the first one, bladder capacity. How much can your bladder hold? A healthy adult bladder can comfortably hold 300 to 400 milliliters of urine. That's about this size of water bottle, or roughly the size of a grande latte. Now, if you feel like you have to go pee after just a few sips of water, or you're constantly rushing to the bathroom, your bladder might not be stretching and filling the way it should. On the flip side, if you feel the urge or you go long times without urinating, that also signals a problem with sensation or communication between your bladder and your brain. Next, urination frequency. Most people should be peeing about 6 to 8 times during the day and maybe once, if at all, during the night. Now, twice a night is normal if you're over age 65. If you're going more than that, especially if it's disrupting your sleep, you may be dealing with overactive bladder, irritation, something like that. Less than that could indicate an underactive bladder or even fluid retention. So this is a great number to track. Third is urination or voiding intervals. Now that means how often you're going throughout the day. Ideally, you should be urinating every 3 to 4 hours. Now that's on average. However, if you're going every 30 minutes or rushing to the bathroom just in case, your bladder may have learned to signal urgency prematurely. Now, did you know that can be retrained? But first, you need to recognize the pattern. Fourth, urine stream. A normal urine stream should start right away and be strong and continuous. Hesitancy, where it takes a little while for the stream to get started, if the stream is weak or if there's a lot of start-stops to your stream, that may suggest pelvic floor or soft tissue tension, urethral restrictions, or some changes post-surgery. Women can experience stream issues too, especially after pelvic surgeries or with prolapse. Next one, urine color. Now this is an easy one to identify. Ideally, the color of your urine should be clear to a very light straw colored. Is it dark yellow or amber? That's usually a sign of dehydration. If it's consistently too clear, you might actually be overhydrating. Yes, that is a thing. However, if you notice pink, red, or cloudy urine, that's a red flag and you really should call your healthcare provider to get that checked out. Next, stream completion. Well, what about when you're done? A normal bladder should empty completely. That means the stream stops without dribbling or any leaking afterward. If you feel like you're not done, you feel like you have to push the pee out, or if you experience dribbling after you've zipped up, you could be dealing with pelvic floor dysfunction, pelvic floor weakness, or incomplete emptying. This is something we address a lot in pelvic floor physical therapy, and we can get some good results. Next one, no pain. This one should be pretty obvious, but it's still often ignored. Urination should not hurt. No burning, no stinging, no discomfort. Pain with urination could point to infection, inflammation, or muscle involvement or nerve involvement. If it burns or hurts every time you pee, that's not normal, and you really should seek help. And finally, normal urge sensation. A healthy bladder gives you enough warning that it's filling and it's time to go, but not so much or so quickly that you're caught off guard. You should be able to feel your bladder filling gradually, and you should have time to plan your bathroom trips without anxiety or without rushing. Now, if you feel a sudden strong urge that comes out of nowhere, or worse, leaking as you get to the toilet, that's something we can actually retrain with strategies in physical therapy or through some of our online resources. Now that you've got the checklist, how do you know where you stand? Well, I've created a free bladder baseline assessment you can download using the link in the description. It's simple, it's easy to fill out, and it helps you track how your bladder is performing in each of these 8 areas. Whether you're trying to get your urgency under control, you're trying to stop urinary leakage, or you just want to understand your bladder better, this is a great place to start. Just click below to grab your free copy. You can also bring it to your doctor, your pelvic floor physical therapist, or use it to guide your own self-care plan. And if this was helpful, don't forget to like, subscribe, and turn on notifications so you don't miss future videos where we will dive deeper into bladder retraining, pelvic floor exercises, and strategies for regaining that bladder control so it no longer controls you. Thanks for watching. I'm Laura McKaig, and I'll see you in the next video.